For many, many years, the standard of care, the initial treatment for graft versus host disease, is systemic corticosteroids. This treatment has remained a standard of care and has potential significant morbidity. Patients, for example, are at high risk of developing clinically significant infections, among other things. They also can develop hyperglycemia, high blood sugar. They can develop metabolic issues, but we really focused for the purposes of this study on infectious complications. This was, again, a phase 2 multi-center study, non-inferiority in design, for a primary endpoint of day 28 overall response rate for treatment of GVHD with itacitinib as opposed to systemic corticosteroids in a low-risk patient cohort. The key findings were that itacitinib, 200 milligrams daily, is as effective as systemic corticosteroids for the treatment of acute graft versus host disease, both in terms of a primary endpoint of day 28 overall response, but also in longer-term outcomes such as survival, NRM, which is non-relapse mortality, chronic graft versus host disease, all the while being safer than systemic corticosteroids with a lower incidence of serious infections and fewer infections per patient when itacitinib monotherapy was used, as opposed to systemic corticosteroids for the treatment of low-risk graft versus host disease. The standard of care has remained a standard of care, systemic corticosteroids, for a very, very long time. What we've shown with this study is that JAK inhibition, itacitinib is a JAK1 inhibitor, holds promise as a potential treatment for graft versus host disease, and that we can use biomarkers to help select patients for treatment de-escalation and selection of novel treatment paradigms. In terms of a potential future for this study, because this study showed that itacitinib was as effective and yet safer, it opens the door for potentially potential future studies, potentially larger studies like phase 3 trials, to demonstrate that this proof of concept works and that the standard of care potentially may be changed.